Hi everyone, this is Anusha. I'm here to explain about the Parkinson disease. Parkinson disease is a progressive disorder that affects the nervous system and the parts of the body controlled by the nerves. In the early stage of Parkinson disease, your face may show little or no expression, your arms may not swing when you walk, your speech may become soft or slurred. Parkinson disease symptoms worsen as your condition progresses over time. Although Parkinson disease can't be cured, medicines might significantly improve symptoms. Now let's discuss about the causes. Many of the symptoms of Parkinson's are due to the loss of neurons that produce chemical messengers in your brain called dopamine. When dopamine levels decreases, it causes irregular brain activity, leading to problems with movement and other symptoms of Parkinson disease. The causes of Parkinson disease is unknown, but several factors appear to play a role, including genes. They are uncommon except in rare cases, with many family members affected by Parkinson disease. Environmental triggers. Exposure to certain toxins or environmental factors. The presence of Lewy bodies. Clumps of specific substances within brain cells are microscopic markers of Parkinson disease. These are called Lewy bodies. Alpha-synuclein found within Lewy bodies. Although many substances are found within living bodies, scientists believe that an important one is the natural and widespread protein called alpha-synuclein, also called A-synuclein. Risk factors. Risk factors for Parkinson disease include age. People usually develop the disease around the age 60 or older. Heredity. Having a close relative with Parkinson disease increases the chances that you will develop the disease. Sex. Men are more likely to develop Parkinson disease than women. Exposure to toxins. Ongoing exposure to herbicides and pesticides may slightly increase your risk of Parkinson disease. Now let's see about pathophysiology. Degeneration of substantia leads to loss of dopaminergic neurons, which leads to the deficiency of dopamine and causes abnormal movements, impaired balance and posture. All these factors leads to the Parkinson disease. Now let's discuss about symptoms. Parkinson disease symptoms can be different for everyone. Early symptoms may be mild and go unnoticed. Symptoms often begin on the side of the body and usually remains worse on that side, even after symptoms begin to affect the limb on both sides. Parkinson symptoms may include tremors. Rhythmic shaking called tremors usually begins in a limb, often your hands or fingers. You may rub your thumb and forefinger back and forth. This is known as pill rolling tremor. Your hand may tremble when it's at rest. The shaking may decrease when you are performing tasks. Slowed movements known as bradykinesia. Over time, Parkinson disease may slow your movements, making simple tasks difficult and time consuming. Your steps may become shorter when you walk. It may be difficult to get off a chair. You may drag or shuffle your feet as you try to walk. Rigid muscles. Muscle stiffness may occur in any part of your body. The stiff muscles can be painful and limit your range of motion. Impaired posture and balance. Your posture may become stooped, or you may fall or have balance problems as a result of Parkinson disease. Loss of automatic movement. You may have decreased ability to perform unconscious movements, including blinking, smiling, or swinging your arms when you walk. Speech changes. You may speak softly or quietly, slur, or hesitate before talking. Your speech may be more of a monotone rather than having the usual speech patterns. Diagnosis. Diagnosing Parkinson disease is primarily clinical based on the patient's history and neurological examination. Key diagnostic criteria include presence of two or more cardinal motor symptoms, which include tremors, bradykinesia, rigidity, etc. Response of dopaminergic medications. Example, levodopa. Image testing such as MRI or PET scans. Treatment. Medications. Levodopa, the most effective treatment. It is converted to dopamine in the brain, often combined with carbidopa, to prevent peripheral metabolism. Levodopa plays a major role in Parkinson's disease. Mechanism of action. Levodopa, also known as L-dopa, is a precursor to dopamine. Dopamine is a neurotransmitter that is deficient in Parkinson's disease due to the loss of dopamine producing neurons in the brain. Levodopa crosses the blood-brain barrier and it is converted into dopamine in the brain, thereby replenishing dopamine levels. Dopamine agonist mimics dopamine effect in the brain. Monoamino oxidase B inhibitors prevents breakdown of brain dopamine. COMT inhibitors prolong the effect of levodopa by inhibiting its breakdown. Anticholinergics help reduce tremors and rigidity but are less commonly used due to the side effects. Surgical treatment. Deep brain stimulations. Electrodes are implanted in specific brain areas to deliver electrical impulses, modulating abnormal brain activities. Deep brain stimulations can significantly reduce motor symptoms and medications needed in advanced Parkinson's. Supportive therapies. Physical therapy. Focus on improving mobility, balance, and flexibility. Occupational therapy helps patients maintain independence in daily activities. Speech therapy addresses speech and swallowing difficulties. Complications. Thinking difficulties. You may experience cognitive problems such as dementia and thinking difficulties. These usually occur in later stages of Parkinson's disease. Depression and emotional changes. You may experience depression sometimes in very early stages. Receiving treatment for depression can make it easier to handle other challenges of Parkinson's disease. Swallowing problems. You may develop difficulty with swallowing as your condition progresses. Saliva may accumulate in your mouth due to slow swallowing, leading to drooling. Chewing and eating problems. Late stage Parkinson's disease affects the muscles in the mouth, making chewing difficulty. This can lead to choking and poor nutrition. Sleep problems and sleep disorders. People with Parkinson's disease often have sleep problems, including waking up frequently throughout the night, waking up early, or falling asleep during the day. Patient counseling. Stay healthy by eating nutritious food and not smoking. Make changes in what you eat or drink if you have swallowing problems. Use speech therapy to help you adjust to changes in your swallowing and speech. Stay active as much as possible when you feel good. Do not overdo it when your energy is low. Rest as needed during the day and avoid the stress. Use physical therapy and occupational therapy to help you stay independent and reduce the risk of fall. Place handrails throughout your house to help prevent falls. Place them in bathrooms and along stairways. Use assistive devices when needed to make movement easier. These devices may include special eating utensils, wheelchairs, bed lifts, shower chairs, and walkers. Talk to a social worker or other counseling services to help you and your family cope with the disorder. These services can also help you get outside help, such as Meals on Wheels. I hope this is helpful. Thank you.